Obviously, treatments vary depending on what type of skin cancer it is. And obviously, the most definitive thing is we cut it out. But if someone came to me and they've got a whole heap of those small actinic keratoses, so those sun damages, the scaly bits, and I'm thinking, are they early squamous cell carcinomas as well? We might do a field treatment. So that could be something like a cream Efidix, which would apply twice a day for 4 to 6 weeks. Or with the new RSR, so the rapid Efidix, you could do that in 6 days, which I get far more compliance. Anything that flares is damage to skin, really. It's got sun damage and it may be precancerous. What we'll do is we'll review you through it, through the treatment process, no matter which, whether you go the 6 weeks or the 6 days. And then anything that remains some weeks after, then clearly this hasn't cleared it. So then that would be what I would excise. You'll see us, we come up to you with our little dermatoscope and we have a look where the edge is. We'll mark that, we check that we've got the right margin, and then we draw our margin on it, and it almost looks like we're drawing an eye on you a lot of the time if it's a simple ellipse. And then we just cut that, and obviously we put local in so you don't feel it. Please, if ever you feel anything with the doctor and when you're in an excision, let them know. They can put more local or wait for it to work a bit longer. And then we excise it, and then we suture you up. And depending where it is and what sutures we've utilised, you'll come back in 7 to 10 days. We remove them and we give you your results. With those results, what they do is they check under the microscope, have we got all the lesion? Is there normal skin next to it? That's what we want, is really good margins of normal skin. So that way we say that, yeah, we've cleared it. Other ones, so we can use a different cream for the case of basal cell carcinoma, so that little pink one, pearly one, we can use a different cream for that, Aldara. And depending on what we think it is, the regime for it, will depend how often you apply the cream and how often we review you. Obviously, if it's still there at the end, once again, we cut it out. If we think it's melanoma, we tend to want to cut it out fairly quickly. And depending on the size of it, depends on how wide those margins are that we need to excise for you. So it's really important. That's why we sit there measuring it and we discuss and we draw around and make sure we've got good margins. Obviously, if it did come back melanoma, we obviously don't want to do the 5 mm margin either side of a lesion straight up, especially if we're talking a lady's face. We don't want this huge scar on her straight away. So initially we'll do 2 mm margins. We'll wait for the histology. If it does come back that it's melanoma, that's when we might do something wider. And that's why we do it. We don't want to give you a massive scar for something that was just a hunch. We don't want to cut out stuff we don't need, or too much skin if we don't need to. So that's why we do initially, when we think it might be a melanoma, we do a 2 mm border, and then you may have to come back for what we call a wider local excision, because it depends how thick that is to how wide we go. One of the best things about skin cancer, though, if we're going to say there's anything good about a cancer, is skin cancer. Skin's outside. We can see it. I can't see your liver. I don't know if you've got a liver cancer. I can't see your lungs. That's where we have to send you for imaging and such like, isn't it? Skin cancer, it's on your skin. Every year, I can look over your skin, have a bit of a squeeze, get my dermatoscope, determine if there's vessels, have a look at the border, and determine if I want to cut something out. I know it sounds scary, but a lot of the time all we're doing is we're just removing a small little bit of skin, get it tested, and then they determine what it is under their microscope. Best thing about it, early. If you come and see me every year, I'm going to see something really, really small, really early. You'll have a tiny scar. If you don't see me for 10 years, it's going to be huge by the time we get to it. And therefore the scar's a lot larger. And also there is always the risk, if you leave it too long, that it may have metastasized somewhere else, so it may have travelled elsewhere in the body. But the best thing about skin cancer, I can see it. Let's remove it. Come see me every year. Let's have a look. Use it as a catch-up if you like, but the best thing is, we get to see your skin, we get to see any changes, and we can really make good advice. And early treatments are far better. The cream, do the creams. You don't need to be locked into. There's no need for an excision. Do some of the other things that we've got access to, like photodynamic therapy. That will get rid of sun-damaged skin. Ladies like it as well. It tends to make you look a little bit younger as well. All these things are imperative, and it's so important that we get to them as early as we can, so that we have far less damage, far less surgical excision, far less scar, and far less chance of it actually going elsewhere. And the best part, once I've got it and I've got a good margin, cured.